Good morning, Year 12. This is the last PowerPoint before the summer holidays. So this is the last push, last bit I want you to have a look at. I apologise now. I have seemed to have woken up with the worst hay fever ever, so I may sound a bit bunged up as we go through the PowerPoint. This PowerPoint here is looking at supporting routines, assessment, care and support planning, and specific responsibilities of people that work in health and social care. So this is a voiceover PowerPoint for the 13th of July, or the beginning of the 13th of July 20. The key words that we need to look at for this PowerPoint are informal care, formal care, code of practice, anti-discriminatory practice and prejudice. Hopefully you have remembered the majority of these, but just to refresh your memory, informal care is the care that's provided by your friends or your family. These aren't professionals, these aren't people trained. Formal care, on the other hand, is care provided by qualified and trained professionals, such as your doctors, your nurses. They have had the training required to be able to look after you. Code of practice is a standard of behaviour and professional practice. It is required in health and social care practitioners. For example, I always sort of say this when you're looking at code of practice, a teacher wouldn't come into a classroom swearing their head off. That's not what is expected, a standard of behaviour in a teaching profession. And I suppose the same as nurses, you wouldn't expect them to go around hitting their patients. Anti-discriminatory practice is care practice that ensures that individual and different needs of clients and patients are met, regardless of their race, ethnicity and sex. So it's making sure people are treated equally, really. Prejudice. These are our preconceived opinions or fixed attitudes about a social group that aren't based on reason or evidence. If you think about it, travellers, there's a lot of prejudice around travellers or gypsy, as the slang names to call them, and people think that they just leave rubbish over the place. They don't actually see them as individuals, and it can affect the way in which they're treated. It's important when we're caring for people that we realise that they are more than just the person's physical illness sitting in front of us. We need to look at their day-to-day life, their family life, education, employment, leisure activities. There is more to a person than just their physical illness or their mental illness. And some of the things that say, for example, they live in a family where they've been neglected, that could have an impact on their mental illness. It could also have an impact on their physical health. As an example here, a nurse should not just attend to a service user's physical needs, but also be aware of the wider social, emotional, spiritual and educational needs. These needs may be just as important for a speedy and successful recovery. If you are looking after an elderly person and they've just been sent back from hospital and you go to put them back with their grandchildren, but they're not happy because they're being treated badly, then this could affect them getting better, and this could affect their mental ill health as well. We really need to look at the needs of the whole person, so we're looking holistically. It's important to be able to support the people you're looking after to maintain a full life. Health and social care professionals should be aware of the community that someone lives in, their work, family circumstances, financial situations, interests, hobbies and aspirations. As teachers, you may have noticed in the media that they are saying with the COVID-19, key workers and those children that are vulnerable should be in school. So those children are vulnerable that have had some interaction with social services, their home life may not be great, there may be some form of abuse at home, or they might be in foster care. There's lots going on that really could affect the person's, the way in which they behave or way in which they recover from illness. You should also be aware of any informal support that can be provided by friends and family. Throughout COVID-19, there has been those elderly people that have not had any help or support from family and friends, and they've become very isolated, and it's really affected their mental ill health. Before an elderly person is sent home from hospital, the reason why that they can bed block is because they are looking at ways in which they can get them either home safely or into a care home so that they can be looked after properly if they haven't got any informal support where they live. Regardless of your job in health and social care, there will be a point where you're expected to plan for the care of the person you are looking after. Health and social care professionals have a wide range of skills. They're more likely to take a similar approach to planning and evaluating care. They tend to follow something called the care planning cycle. That may have refreshed your memory of something you revised last year. It involves assessing the individual's healthcare needs, looking at what type of help and support that they need, what are the problems, what are the physical problems or mental problems. Then you're working with the individual to create a care plan that promotes the service user's health and well-being. And then you evaluate the effectiveness of the care implemented. So the care is carried out, and then you sort of go, oh, hang on, that's working, or that's not working, or we'll stop this, or we'll continue with that. If there is no evaluation, things could start to you could start to waste the NHS money, so they could still be attending appointments they don't need, especially if their health is improved, or they might not be getting all the care. So if the conditions worsens, they might not be getting the extra care and support they require also. Here's a diagram of the care planning cycle, which I think explains it that little bit better. I do like to have a little bit of a diagram just to help me visualise what we're on about. So the care planning cycle is first of all about assessing the client's needs, planning where possible, agreeing the most appropriate care, implementing the care plan, so making sure that they're able to visit the specialists that you have referred them to, monitoring the effectiveness of the plan, what's working, what's not, reviewing and evaluating the effectiveness of the plan. Is there anything that needs to be changed or amended, which is what the last bit we came to, is amending the plan as necessary. It's really important to make sure that you aren't wasting resources and funding that could be better spent elsewhere, especially if your condition has improved. Professionals will assess the needs and agree the appropriate care with the service user, and where appropriate they might get family members involved or informal carers to get them involved in the care planning process and see what will work and what won't. Informal carers often contribute to the reviews and the evaluations of the care provision, and they might be able to help discuss alternative strategies. This might be more beneficial for those that have communication problems or mental health problems or unable to communicate effectively. So we get onto our first exam question. Janet is 58 and has been in hospital for 2 weeks due to a respiratory problem. The consultant has told her that they will be devising a care plan for her. Explain what a care plan is and its role within the care planning cycle. So really here you've got 2 questions in one for 6 marks. The first thing you're going to need to do is define what a care plan is and why they're used. And then you need to look at the care planning cycle. Where does a care plan actually fit in? And what is done with that care plan to answer that. Now you can go back through the notes you've just done, you've just written regarding the last few slides, and try to answer this in the best possible way that you can. As it's explained, it's a little bit more in depth. There's 6 marks, so you're going to need to make sure you've covered 6 whole points in this question. So now we're going to look at the specific responsibilities of people who work in health and social care settings. Now there's certain requirements that they must fulfil. They're expected to work to high professional standards. They must follow agreed policies and procedures. There's also like a value system, which includes commitment to, and it's the same as teaching, making sure that you are promoting anti-discriminatory practice and making sure people are not being discriminated against in regards to their race, religion, gender, etc. A value system to empower individuals, to enable them to take control of their lives. So empowering someone is to be able to give them choice over their life, to help them to remain independent. You're ensuring the safety of staff and the people that they care for. That's very important. Maintaining confidentiality and privacy to make sure that there is trust and that nobody comes to harm. Promoting good communication between carers and their clients, and adapting your communication to meet the needs of the people that you're working with. All health and social care professions have codes of practice. For example, the General Medical Council, the GMC, sets out and monitors standards and behaviours for doctors. The Nursing and Midwifery Council sets out and monitors standards of behaviour for nurses and midwives, the way in which they expect them to behave. The recently formed Healthcare Professions Council, the HCPC, sets out and monitors standards for social workers and a range of other health professions. It's worth having a look at the HCPC and seeing who else that they cover. So, what's the importance of having the General Medical Council professional body in charge of doctors? I want you to think very carefully about what is the GMC and also what its purpose is. If you need to Google it or look at your past notes, please do. It's better that you actually, I mean, obviously have a go first, but it's obviously better that you refresh your memory and make sure you're right here. So it's worth 4 marks, so it needs to be more in depth than a sentence. It's also explain rather than describe, so more depth is required. You can't just put, it is the profession that looks after doctors. That's not going to be good enough. So what do they do? How do they oversee doctors? Adapting health and social care provision for different types of service users. We have sort of discussed this earlier in the way in which things can be adapted to make things easier. And despite the legislation that underpins policies and procedures, there is still often prejudice and discrimination, and it's ways in which that can be got rid of. In care settings, anti-discriminatory practice involves promoting equal opportunities for all. It's about addressing your own prejudices and adapting your behaviour to ensure clients' needs are met, whatever their background. Understand and meet the needs of all service users, including people from diverse cultures. Just because you don't agree with another person's culture, that is no right for you to not give them the high quality care and attention that they deserve. You've got to celebrate the contribution a wide range of diverse range of people can bring to the setting. Excuse me whilst I sneezed. Actively challenge both intentional and unintentional discrimination. It's very important that there are whistleblowers and also so that you can report instances of discrimination if you witness it. Ensure that a setting is a welcoming and accessible environment for all, and compensate for the negative effects of discrimination in society. This isn't a must, but if you wish to watch, I have included a link to a documentary on disability. In considering the Human Rights Act 1998 and the Equality Act 2010, the Equality Act 2010 prevents discrimination on the grounds of disability, and the Human Rights Act guarantees the individual a right to life, freedom from torture and inhumane treatment, freedom of expression, respect for a private life, and liberty and security of a person. So when you watch that documentary, if you wish, or you watch anything else where it discusses disability, it is worth considering the Human Rights Acts and Equality Acts and why they're in place, and the purpose of them to try to give a legal preventative measure to stop people discriminating. So a quick few questions here. There's 2 here, and the first one is describe who are the Nursing and Midwifery Council and what do they do, and who are the Health and Care Professions Council, HCPC, and what do they do? What professions do they oversee? Now the 4 marker is going to require a lot more depth, so you need to look about what professions they actually oversee. Now I did mention it was social workers, but who else do they oversee? You might need to have a look that up. What is their purpose? How do they try to improve the way in which health and social care professions are perceived and the expectations? Have a good look at those 2. One requires 2 marks, one requires 4 marks, so one will require more depth than the other and detail than the other. When working with people with physical disabilities or mental disabilities, provision needs to be adapted to meet their needs. For example, if you've got a doctor's surgery, you're going to need to see people who have physical disabilities. So they should be able to access the doctor's surgery using ramps. There may be lifts required. Toilet facilities may need to have widened doors on a lower level. Then they need supports and aids to help somebody onto the toilet. And it's really important that they're there to help prevent people from feeling a lack of independence. And it's important that they feel empowered. If a service user has a hearing impairment, it may be necessary to use written and visual communication. For the service users who speak little or no English, information may need to be available for a number of different languages, like they do in hospitals. It's written, it might be saying hello in a variety of different languages, or points to this so that we can help you. In a multicultural setting, dietary requirements will need to be met. and religious and cultural festivals respected and observed. It's so important to understand the key terminology of empowerment. Empowerment is supporting people to take control of their lives and futures by taking part in full discussions and decisions about their care and treatment. So it's involving them in their care. What could you do to empower somebody? For example, somebody who can't get their shoes on but doesn't really want the help and assistance of somebody else, perhaps you could pass them a large shoehorn so that they'd be able to put the shoes on by themselves. Involving them in decisions over dinner, what they would like to eat, what they would like to drink, will help people feel in control rather than in the decision of what they should eat or putting a person's shoe on for them, because it can make people feel very undignified. Promoting individualised care. Empowerment enables service users to understand the choices that they can make about their care. Care should not be service-led, so you shouldn't be telling them what they should be doing, because then people can start to lose confidence and then they become over dependent on what the doctor, nurse or carer says rather than being able to make their own decisions. In most cases, a client's consent is needed before carrying out a care procedure or treatment. If they're empowered, they should be fully involved in discussion about planning their care and understand the options available to them. The best you can possibly do is empower people in your care as much as possible. Empowering service users means that they're more likely to be treated as individuals. Their needs and preferences will be known and respectfully considered. This provides a context in which their rights to dignity and independence, which will contribute to boosting their self-esteem. So being treated as individuals, given choices, will make sure that they feel more confident, more happy, more have high self-esteem, rather than somebody doing all for them. Because you can imagine imagine your parents are constantly making decisions for you and you weren't given a say, how that would make you feel. Providing active support consistent with the beliefs, cultures and preferences of service users. Health and social care provision in a multicultural society must address the specific needs of people from diverse backgrounds. They can have different beliefs, languages, traditions, diets, and they can be very varied. In lots of cases, diversity can be celebrated. If people do not speak English, information will need to be presented. There may be a need to provide a wide range of food. For example, people that can't eat pork or beef, the food can be adapted, or vegetarian options provided. And religious observances may need to be considered. So if you're caring for somebody and they would like to go to a church, then you can perhaps arrange some prayer time or a visiting vicar or a priest to come to see them. Not all services users will have the confidence or personal skills to participate fully in their care. For example, if they have speech or language problems, support could be provided by signers to come in and sign for them, translators, interpreters if you don't speak the language. Advocates are there to speak on another person's behalf. This could be because they have learning difficulties, mental health problems, or are unable to speak effectively. And family and friends are also good options to have with you to help explain the type of care or support that you will need. The only problem with having family and friends sometimes is that you're not always sure of the family situation at home or if there's any ulterior motives. So you just need to be very careful of that. If you can't remember the difference between a translator and interpreter, I would really look those up, because one translates the written word, one translates the language. If you can't remember what a signer is or an advocate, although I did explain an advocate on the other slide, have a look. Really refresh your memories of these, and then think about how they can support a service user. So we are aware that everybody needs to have their rights and choices. However, it's not always possible to make sure everybody's needs or rights are met, because when you work, say for example, in a care home and you have 20 residents, one is desperate to go to church but the rest are atheists, you've got to balance it up. How best are you going to get one to church using a whole member of staff to take them, and it takes them away from the home compared to those that don't want to visit? Is there something else that you could put into place? So it's not always straightforward. There may be conflict between the preferences of one service user against another. So if you're offering activities, one wants to do bingo, one wants to do arts and craft. No, I don't want to do that. I don't want to do that. And you've got to try and compromise. The client's right to choice for protecting their personal safety. If they have dementia and wish to live independently, but they cannot use the oven safely, it can pose a fire risk. So although you're trying to give them rights and choices, if it's unsafe for someone to do that, then you're going to seriously need to think about do a risk assessment on how safe you think it is for them to go home, and whether it would be better off to put them living with family or place them into a care home. The different rights that service users have, for example, the right to confidentiality and the right to protection from harm, should be considered, and the respect for cultural values of a service user and promoting their health and well-being. For example, Jehovah's Witnesses don't believe in blood transfusions. So if you are working with trying to ensure that the rights and choices are being met with the people you're looking after, you need to make sure that someone who is Jehovah's Witness doesn't believe in blood transfusion is not given one. Right, the last slide in this PowerPoint, you'll be glad to hear because I have rambled and sniffed and sneezed through this one. Jasmine is 87 and lives in a residential care home. She has mobility issues and struggles at times to carry out her own personal care. She is, however, fiercely independent. How could the carers in the home empower Jasmine so that she still feels in control of her life? So try to think of different ways in the care home that the carers could still make her feel in control and in charge of aspects of her life. So she has mobility issues, but what could be done to resolve that? What could be done to still enable her to remain independent despite the mobility issues that she has? She sometimes struggles to carry out her own personal care. What could be done about that? How could they help her in a way that still helps her remain empowered and independent? So have a think about those, have an answer of the questions 1 to 4 and send them in to me. There will be a quiz at the end of the week for you to have a go at, but as it's the last week of term, you have this PowerPoint, which is rather long, and the quiz to have a go at. Any problems, let me know. And if I don't speak to you before the end of term, have a really lovely summer holidays, and I hope you're able to get out, even though it is social distance. I hope you're able to get out and have a bit of fun. I know my holiday's been cancelled, which is rubbish, but I hope some of you are able to get away or do something that you enjoy. Take care, and I'll see you in September.